Gout is a type of arthritis characterized by sudden, severe attacks of pain, swelling, redness, and tenderness in the joints, often the joint at the base of the big toe. The pain is so intense that even the light touch of a bedsheet can be excruciating. This condition results from an accumulation of urate crystals in the joints, which form when there is too much uric acid in the blood. Our bodies normally produce uric acid when they break down purines, which are substances found naturally in our bodies and in certain foods like red meat, organ meats, and some seafood. In a healthy individual, uric acid is filtered out by the kidneys and excreted in urine. However, in people with gout, this process is disrupted, leading to an accumulation of uric acid in the bloodstream. When uric acid levels become too high, it can crystallize and settle in joints, most commonly in the big toe, although it can affect other joints such as the ankles, knees, elbows, wrists, and fingers. Gout is more common in men than women, though women become increasingly susceptible to it after menopause. Typically, it manifests in middle age, but it can occur at any age. Causes of gout. At the most basic level, gout occurs when there's an imbalance between the production and excretion of uric acid in the body. This imbalance can arise from several different mechanisms. One major cause is genetics. If your family has a history of gout, you are more likely to develop the condition. Your body may produce too much uric acid or have difficulty excreting it. Obesity is another significant factor because more tissue turnover means more purines being broken down into uric acid. Eating a diet rich in purines can also lead to high uric acid levels. Foods like red meat, organ meats, and certain seafood, like anchovies, sardines, mussels, scallops, trout, and tuna, are high in purines. Alcohol consumption, especially beer and beverages sweetened with fructose, can increase uric acid levels. Certain medical conditions and medications can contribute to high uric acid levels as well. Conditions like untreated high blood pressure and chronic conditions such as diabetes, metabolic syndrome, and heart and kidney diseases can increase the risk of gout. Some medications such as thiazide diuretics used to treat hypertension and low-dose aspirin can also increase uric acid levels. Symptoms of gout. The symptoms of gout are typically characterized by sudden, severe attacks of pain, swelling, redness, and tenderness in one or more joints. These attacks, often referred to as gout flares, can occur with little to no warning and are one of the most painful forms of arthritis. The most common site for a gout attack is the joint at the base of the big toe, a condition known as podagra. The pain in this joint can be so severe that even the weight of a bedsheet can be unbearable. Patients often describe the pain as feeling like their toe is on fire, or as if it's being squeezed in a vise. While the big toe is the most common site, gout can affect other joints as well. The ankles, knees, elbows, wrists, and fingers can all be targets for gout attacks. In some cases, multiple joints may be affected simultaneously. A typical gout attack often begins in the middle of the night or early morning hours. The affected joint becomes swollen, red, and exquisitely tender to touch. The skin over the joint may appear shiny and feel warm or hot. The pain typically reaches its peak intensity within the first 12 to 24 hours and can last for several days to a few weeks if left untreated. In addition to joint pain, some people with gout may experience fatigue, low-grade fever, and a general feeling of malaise during an attack. As the attack subsides, the affected skin may peel and itch. Between attacks, individuals with gout are typically symptom-free. However, if left untreated, gout can progress to a chronic state where attacks become more frequent and severe. In chronic gout, permanent joint damage can occur, leading to persistent pain and disability. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of gout. To diagnose gout, your doctor will typically start by taking a detailed medical history, including information about diet, alcohol consumption, family history of gout, and any medications you are taking. A physical examination will be performed to assess the affected joints for signs of inflammation, such as swelling, redness, and tenderness. The pattern of joint involvement can provide clues, as gout often affects the lower extremities first and tends to be asymmetrical, affecting joints on one side of the body. While the clinical presentation can be highly suggestive of gout, a definitive diagnosis requires the identification of monosodium urate crystals in synovial fluid or tophus. This is typically done through a procedure called joint aspiration or arthrocentesis, where a small sample of fluid is drawn from the affected joint and examined under a polarizing microscope. Blood tests are also commonly performed to measure serum uric acid levels. However, it's important to note that uric acid levels can be normal during an acute gout attack, and some people with high uric acid levels never develop gout. So, while helpful, uric acid levels alone are not diagnostic. Treatment for gout. The treatment of gout involves two main approaches: managing acute attacks and preventing future attacks through long-term therapy. For acute gout attacks, the primary goal is to reduce inflammation and relieve pain as quickly as possible. Nonsteroidal anti-inflammatory drugs are often the first-line treatment for acute gout flares. These medications, such as naproxen or indomethacin, can effectively reduce inflammation and pain when started early in an attack. Colchicine, which is an anti-inflammatory medication derived from the autumn crocus plant, is another option for treating acute gout attacks. It works by interfering with the inflammatory response to urate crystals. While effective, colchicine can cause significant gastrointestinal side effects, so it's typically used in lower doses than in the past. For patients who can't take nonsteroidal anti-inflammatory drugs or colchicine, or in cases of severe gout affecting multiple joints, corticosteroids may be used. These can be given orally, intramuscularly, or injected directly into the affected joint. Once the acute attack has resolved, the focus shifts to preventing future attacks and reducing uric acid levels. This is typically achieved through a combination of lifestyle modifications and medication. Lifestyle changes play a crucial role in gout management. These include maintaining a healthy weight, limiting alcohol intake, particularly beer and spirits, and avoiding foods high in purines. Staying well hydrated and engaging in regular, low-impact exercise can also be beneficial. For many patients, lifestyle changes alone are not sufficient to prevent gout attacks, and medications to lower uric acid levels are necessary. The most commonly used medications for this purpose are xanthine oxidase inhibitors, such as allopurinol or febuxostat. These drugs work by reducing the production of uric acid in the body. In cases where xanthine oxidase inhibitors are not effective or not tolerated, other medications can be used. Probenecid, for example, works by helping the kidneys eliminate more uric acid. Newer treatments, such as pegloticase, which breaks down uric acid, are available for severe cases that don't respond to other therapies. It's important to note that when starting uric acid lowering therapy, there's often an initial increase in gout attacks. This occurs as the urate crystals in the joints begin to dissolve, which can trigger an inflammatory response. To mitigate this, patients are often given low-dose colchicine or nonsteroidal anti-inflammatory drugs as prophylaxis when starting urate-lowering therapy. At the end, with early diagnosis, appropriate treatment, and consistent follow-up care, most people with gout can achieve good control of their condition and maintain a high quality of life. Now, we want to hear from you. Do you or someone you know have gout? What treatments worked for you? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.